It's like you go through seasons of really good, like, why are we even here? And then you go through seasons of like, you're just trying to make it to the next session before you,
Sure. Yeah.
break it off and you're like, I'm not doing it. So it's been super good for us as we've gone through stressful times with business and kids and all these things, right? It's just, yeah, I look at it as just like part of life now. Like 2 years ago, we were in a bad spot in a lot of ways, like not happy with each other, weren't sleeping in the same bed, like, it was rough. And around the same time, we both decided to get on hormone therapy. So I like did TRT and she got
Yep.
estrogen, progesterone. I don't remember. She
Like
was
both. Yeah.
yeah, a little patch and then gives like an injection every little bit. Anyways, it was amazing to me at like how much that affected our counseling. Like our counseling was like supercharged, like jet fuel for counseling,
Hmm.
or vice versa. Now we could talk about problems, but also just when you can talk about problems all day long, and when you have the physical malaise and you're just absolutely worn down, it is so hard to make any forward progress. And I was like, God dang it, why don't you guys prescribe hormone therapy? Like, how many freaking couples are in their 40s and 50s and like are just smoked physically and without outside help will never get past this point. So I was telling my mental health counselor, I was like, you have to like learn about the signs and symptoms to like cross refer. Like, this is unbelievable. And she was like, yeah, well, therapy also worked. I'm like, I know, but we went to 5 years of it and it like,
Yeah,
it was
it
good, but
does,
not
and it
great.
helps.
Yeah.
And it helps. And I always encourage a lot of women, especially if they're really struggling with anxiety or they're, you know, maybe grieving, especially, when you hit your 40s, you maybe lose a parent or things like that, right? I say, yes, I
Yeah.
totally encourage therapy, CBT, whatever. But I said, I get people in my office all the time that are like, I'm such a bitch and I'm so moody. Can I swear on this? I'm such a bitch. I'm so moody. I'm out of control. Like, I'm worried like my husband's going to leave me.
Right. Yeah. Which is interesting that they self-recognize that that's not the version they want. I think it's different when they don't
Yeah,
realize, but then they realize that stark contrast, like, that's not who I want to be, means that you do have moments of clarity of who you want to be,
totally.
Yeah, that's interesting. So you put them on some hormone therapy and seem to like stabilize things.
Yeah. Well, it's funny because when I talk to patients, I'll be like, "Oh, like, how's your mood?" They're like, "Well, ask my husband." Or sometimes in a follow-up, they're like, "Oh, my husband said, like, last period wasn't as bad. I was like, things were better." I'm like, "Okay, fantastic, right?" Not that it's just up to them. I want you to feel good too, but that is a huge part of it, right? Our relationships and our, social circle suffers
Sure.
through hormonal changes, whether it be men or women, right? So yeah, it's always nice when someone comes back and it's like, "Oh yeah, that actually didn't really made a difference," or like my libido's back, or things that are important in marriages and relationships.
Yeah, and the funny thing is, I'll just heap some praise on your profession, is if you look at most of the pharmaceutical ways to help somebody, always the most effective with least risk are always just take things that are already in our body and just give it to us. Like blood doping, I think, is the best example of that. You're literally not doing anything except taking out blood, waiting, set a timer for 6 weeks, give it back to them, and it's like, oh my God, I can win the Tour de France. And it's like,
Right.
you're only giving them back blood that was literally in their body. There's not
Yeah.
a chemical being added. You're not running it through an
Yeah.
oxygen.
Nothing crazy.
No, and it's just like it works every time. And I think hormones are in that. Like, yeah, we produced this stuff. We did well. It was amazing. And then when it faded off, we get stuck in these horrible situations. And, modern life is not exactly rewarding to hormone production and regulation, right? Like, hey, you're inside, you're out of natural light, you're not exercising, you're not moving your body by walking. Like, I'll hop in a car and sit longer because that's what I need to do.
Well, I'm glad you bring up that too, because like, we talk about hormone therapy, but that's not it, right? Like so many other parts of someone's life or, the foundations of health, as we call them, really matter too, right? So like, making sure someone is sleeping and going to bed at a reasonable hour and not just, scrolling all night. I had a patient yesterday, she goes to bed at 2 o'clock in the morning and she's like, yeah, I just kind of scroll. And I'm like, why are we doing that? But
Yeah.
there's more to it. But
Yeah.
and then, nutrition, right? Making sure people are eating lots of fiber and greens and protein and that kind of thing, right? And exercise is so important, right? Which I think I say,
I'm out here in the desert and it gets in the summer, like it's sustained over like the coolest it'll go 90 degrees Fahrenheit. And I don't know what that is in Celsius, but it goes like 90 to 120. Yeah, too hot. And I can't tell you how many patients would tell me I'm irritable, I'm really sore all the time, I can't sleep, and surprisingly, I have swelling in my feet and legs. And it's like, yeah, I know this sounds counterintuitive, but just get really well hydrated. And they do it, and 3 or 4 days later, like, oh my God, I feel so much better. I feel so much like you could give them all sorts of pharmaceutical agents, and it's not going to give them that general health, pillar of hydration. And I thought this was okay. And then I went through it with my mother-in-law. They were living with us when they first moved out here. Their house is being remodeled. They lived with us. She was complaining about stuff all the time, and it all traced back to that. And, my wife and I, who are both chiropractors, we don't know anything in her eyes. Like,
Yeah, of course not.
but she went to her doctor and said, yeah, you should drink like 64 ounces of water a day. And she's like, oh my God, that's a lot. He's like, you're out here, like, it's bone dry, humidity wise, and hot. Like, you can't drink enough. She did that 2 weeks later. She was like completely different person.
All her ailments are gone. Wow.
Yeah.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of trust-driven care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust-driven insights, real conversations, smarter care, stronger business.